3, and you've already hit the
I have.
All right, 3, 2, and Dr. Kellum, last time we talked off the air, we kind of talked about the importance of heart health and signs of when guys or gals need to get checked. What are some signs that people need to look for as it pertains to heart health?
Well, aside from the obvious chest pain,
Yeah.
who are you talking about? Certainly with chest pain, if you have any kind of chest tightness, shortness of breath, that's an important time to call your doctor or go to the ER so that can be checked. And that's one that is, I think,
That's kind of the
obvious.
easy one, yeah.
But you say that, Gabe, and we look at that, and often people will get chest pain. They'll mistake it as reflux, or just want to pretend that it's reflux and let it go for a while. And unfortunately, sometimes those can be quite perilous for individuals and fatal in some cases.
Yeah.
And so those are the things that we always want to be mindful of. So what I talk to my patients about is if you feel anything in the chest, call. Let us always make sure that everything is okay. Because sometimes we don't have that second opportunity with the heart. 30% of the people, maybe, roughly, I should say, that have an event is their last event, meaning that's their first in time and it's fatal. And so it can be quite perilous. And so chest pains are one of those things that can be a little bit ubiquitous, but certainly and people tend to let it go, but it's certainly something that we don't want to play around with. So we encourage everybody to get checked and be seen, and certainly let us as healthcare professionals work you up to the extent necessary to get things better. And that doesn't always mean hospital. A lot of times things can be done via lab or outside of that to make sure that things are fine. But I will tell you some of the more important things, if I may continue,
Sure.
is really looking at subtle changes. So one of the things that we look at is shortness of breath. And it's an interesting thing. So for example, if you're sweeping, ladies, men, if you're sweeping your house and you find that what I used to be able to do, I could sweep the kitchen and the living room without any issues, but now all of a sudden I get tired and short of breath halfway through. Those are kind of telltale signs that aren't what we classically hear, but certainly can be issues that need to be looked at. So we call exertional dyspnea, so getting tired when you do things, exertional fatigue, more than you would expect. Those are the types of things that people should look at as an indicator for possibly heart disease. It can be many things, but that's one of the things that we look at. So we want people to be keenly aware of that, because those are those opportunities for us to be able to intervene and make a difference.
Other symptoms that I've seen in the past, you and I have never talked about this, but kind of a cramping sensation in your left arm, jaw pain. Those are also things that people need to look for.
Yeah, and those are part of the classic things that we look at. So crushing chest pain to the jaw, always very important. Shortness of breath, nausea, radiation to the left arm. Those are the things that we classically know as chest pain, which I think certainly can never be ignored and need to be taken care of. It's the people that have subtle or atypical type pains that we really want to catch, because that represents maybe 70% of the people that we're looking at. And those are the ones that you really want to make a difference, because if you catch them early, you're able to intervene. Let's just say, God forbid, they have a blockage, and you can open things up with a cath and a balloon. Those are the individuals that don't have heart damage, that they have open arteries, that they can begin to heal and get better. And we've changed the course of their lives in terms of that issue. And so now wives keep husbands and kids keep husbands or dads, and moms, and moms, and it makes all the difference in the world. And so, although this month is a big focus on breast cancer awareness, and we also want to promote that again today, the heart disease is one of those things that can happen anytime for any reason, and we want to make sure that people are aware.
And science has advanced to the point where if you have some sort of blockage, you have some sort of issue, they're no longer going to crack open your ribs and do a full bypass. It might be needed, but science has advanced to where these types of heart issues can be rectified.
Oh, absolutely. The greatest thing is that, looking at just how we diagnose them. So screening studies like CT calcium scores, which are a simple study for those out there, that you go to a CAT scan, 15 seconds, you're laying there. They do an image that basically gets pictures that are slices of your heart. And what they look at the amount of calcium depositions and around the arteries of the heart, it's super cool because they give us a measurement. And this gets into the weeds, but I think it's fun for people to know. You get a score. If your score is 400 and less, your risk of heart disease is small. If it's 400 or more, it's an opportunity for us to move forward and look
Sure.
and see. And that's $125. It's easy to do. It's a simple test, but it gives some affirmation that you're healthy, or it gives some evidence that we may want to look forward. And so that's one of the things. Another thing that's kind of cool is how they do heart casts. So it used to be where they would go through the groin, look to the heart. You'd have to lay there 8-10 hours. People didn't want to do that. Now they can go through your wrist.
Wow.
They can go through there. They can do a number of different things in terms of diagnosing heart disease, opening up heart disease. They can do valve replacements via endovascular approaches. There's just a variety of things that can be done. And so I think one of the take-home lessons, and it's a very good point, is that our old mindsets of how things work
exactly.
have really changed. And so as with everything, cell phones, computers, medicine evolves rapidly. And these new technologies are less invasive, less problematic, less side risk of complications, but certainly greater risk of outcomes that are positive for everybody that's out there. So, that's a really important thing to remember, because you don't want to shy away from care, because care really gives you the opportunity to have a life that you want to live.
And we work with some fantastic cardiologists
Right.
in and around not only this Tri-County area, but citywide. We've got some great cardiologists to where if there is an issue, it gets taken care of.
For sure. We do a lot of work with Methodist Northeast, and they do a phenomenal job.
Yeah, John Canales is one of our guys. He saw me.
Yeah, he did, and I feel bad for him about that.
I know. I broke his bench. Yeah, I still owe him a bench. I sat in it, and it just made this really splitting crack sound. It was bad. But
aside from that,
it was a great
No,
message.
he's phenomenal.
Yeah,
Trained at Texas Heart Institute, does a phenomenal job.
Sure.
I trust him with our patients. I trust him with my family, which is really how we choose the specialists that we do. But if there's any questions, we get people to see him, and he does a really great job. And it kind of goes back to the things that we always talk about. If you have questions, ask, because we can answer some of the things that may be kind of plaguing things, or people are worrying. And I don't think people should worry. There's enough stress in our lives.
Absolutely.
That these sorts of things, we can get some affirmation fairly quickly that things are good. And I think we'd be remiss, Gabe, if we didn't talk about, it's wonderful to have all these advances to make things better. It's even better if we can prevent it from even beginning.
Exactly.
And that's where we talk about good living, good diet, good activity, good diagnostic studies, and some of the things that we do in our physical exams, our health grade physicals, that really catch things early. And if we can create the opportunity to understand things early, or work on things dietarily based on some of the lab works that we do, without getting to the point of intervention from a cardiology standpoint, I think it's good. But if we need to, and you're there, we can make it better for sure. And there's things that can be done that don't necessarily have to hinder you forever. You got to buy into good health. You got to buy into the desire to want to get better. But if you do, we can certainly make changes that can really last a lifetime, and a long and prosperous lifetime.
Last question. What are some of the vitamins, supplements people can take to be proactive, along with good eating habits?
I will tell you, fish oil is one of the things that we see, that we can see some definite reduction in fish oils. And I would say talk to your provider about that, because there's different types of fish oil, some prescriptive, some not. But there's some formulations that are really much better at reducing the inflammation. If you don't have inflammation in your arteries, there's not places for plaque to lay down and grow. And so if you can reduce inflammation, and that gets accomplished by fish oil, that gets accomplished by no smoking, that gets accomplished by diminishing glucose. All of those things lead to better vascular health. And when you can do that and prevent areas that get blocked, outcomes are far greater, whether that be in your neck for strokes, or your heart for heart attacks, or in your legs for peripheral vascular disease. All those things are super important. So it all really goes back to diet and exercise, quite frankly. But again, many, many things. If you're past that, let us,
give us a call.
Yeah, give us a call,
please.
because we can help you understand where that is. And certainly there are things that can be done to make a difference.
All right, folks, and he's right. If you feel bad, give us a call, 210-945-2121. Be seen, especially with, and if you're experiencing those types of issues that Dr. Kellum talked about, or visit our website, kellummd.com. The phone number again, 210-945-2121. Folks, if you're feeling bad, come on in. We've got this great, big, beautiful new office here at 3701 FM 3009 right here in Schertz, Texas. 210-945-2121, kellummd.com. Dr. Kellum, great job, my friend.
Thank you, my friend.
All right. folks, enjoy the rest of your day and stay healthy.